I was living in the street. I was homeless. Uh, I had an addiction. It was based to fentanyl, methamphetamines, heroin, and I was selling clothes in the street to support my habit. So during the night, I would go around donation bins all around the city and pick up clothes and shoes and such things. And during the day, I would sell them. And it was this cycle, this 24-hour cycle. I just repeated over and over and over again. I used methamphetamine to stay awake. So, because, like I said, at nights I have to stay awake to pick up the clothes I need to sell during the day. And also, you didn't feel safe sleeping at night a lot of times because you had nowhere to sleep. So that's why I was using methamphetamines.
And so when did you sleep?
Uh, every 3, 4, 5 days, sometimes a week, and you just pass out. Sometimes in alleys somewhere or in a park. That's how. Sometimes in the winter, I did go to some homeless shelters, but again, it wasn't safe. Wasn't clean, so you would go there and lose all your belongings and things like that. So sleep was a challenge.
Sleep was a challenge.
You can get mugged, of course. People take advantage of you. People try to be your friend and then take advantage of you in so many different ways. And also health-wise, it's not clean. There's a lot of viruses going around, and so it's challenged. It's really difficult.
Okay. How much would you spend in a day on fentanyl, would you say?
Probably 200 a day.
$200 a day.
Yeah.
Okay. Okay. And then just in terms of your ability to care for yourself, like feeding yourself.
Oh, that was always secondary.
Secondary.
Yes.
Okay.
So first you have to ask in my drugs. So once I have substance, then you think about eating things like and clothes and so forth.
Okay.
So forth.
Okay. And so it sounds like the drive to use was profound. It was more profound than some of our basic survival drives of feeding oneself, shelter, hygiene, etc. Can you describe what the drive to use fentanyl was like? What did that feel like?
It takes over all your senses. You can't really function without it. Not only psychologically, you want to feel numb. That's why lots of people use it. But also physically, you couldn't go on without it. You start having physical addiction to it. So the drive is huge. Like you said, it's getting substances comes first before everything. Eating your hygiene or your food, stuff like that. Yeah.
And then you were using methamphetamine, and it sounds like the methamphetamine, the primary role was to keep you up at night, so
Correct.
You could go to the donation bins, find clothes, and then sell them. But I think one of the consequences I remember after methamphetamine use was that you started to develop some psychosis.
Exactly. Yes. Yeah. When I came in the hospital, I was experiencing psychosis.
Can you explain to us what it feels like to experience psychosis, or what it felt
Yeah.
like for you?
It was a very strange feeling. For me, I was hearing voices that always put me down. So it was always negative thoughts or negative voices. It's not a thought, but it's actual voice that you hear is actually hearing. And you realize that it's not there, but at the same time it does affect you to the point where sometimes you even start answering it because your brain doesn't differentiate between what it actually hears and what's just in your head. It's that strong.
So was it a voice that felt as though it was coming through your ear?
Exactly.
Somebody was talking. Yeah.
Yes, it's coming from my ear. Yeah, the back of my ear.
Do you remember the first time you heard that voice? What that was like?
I do remember the first time, yes, and it was very sad moments.
Sad.
Sad, yes. Yeah, realizing that I was hearing voices. Yeah.
So you realized that it was psychosis.
I did realize it was psychosis. Yeah. I was hearing voices through the wall, and I knew that there was nothing on the other side.
Okay. Now, but life wasn't always like this for you.
No.
Can you give us a description of what life was like sort of almost immediately before you became homeless and started to struggle with addiction?
Sure. I was working as a navigation officer. I was working on ships and in Great Lakes. And I was married. I have a daughter. I went to college, graduated. So life was normal. Was just regular challenges, challenging career, challenging job, and so it was quite normal. Even growing up, it was normal life. There was no trauma or anything like that. I would say that I had normal life.
It's interesting to hear because sometimes we have this preconceived notion that people living under the circumstances of being homeless, life has always been bad for them, but that's not always the case. I mean, you had a very sort of high level, safety sensitive job. You were a second officer on a large ship. You were married. You had a daughter. You had responsibilities. And so, can you explain what that transition was like? How was it that you went from this particular life to the one where you were living on the streets?
For me, it was sudden divorce, sudden separation that I wasn't ready for and I didn't accept. So I was under shock. My ex-wife had already, because we were separated for so many months a year, 7 months a year. I was away, and so we grew apart, I guess, and she wanted to end it. So for me, it was sudden, and so I didn't have any support from my family either. They didn't understand what was going on. Nobody really knew how to deal with the situation. So I was kind of in the middle. I stayed on my own, and after that, I started isolating and using. I became suicidal. I wanted to kill myself. So I started using heroin to hopefully overdose and die. That was my story, and that didn't happen. Obviously, I'm still alive, but I ended up with the addiction.
Right.
Yeah.
So one of the primary drivers was your struggles with mental illness.
And yes, I did. I was diagnosed with anxiety and depression not long before that. So there was another part of it. I didn't know how to deal with my depression back then.
So I remember you had mentioned that your struggles with mood and anxiety actually even predated your time on the ship and your marriage.
Yes, when I was diagnosed, it told me that I was probably started becoming depressed when I was 16.
16, okay.
Yes, so my teenage years. Yeah.
Do you remember what that was like?
That was very difficult because I would feel the feeling of sadness, but I thought it was normal. Didn't really share it with anybody. I struggled with it. I remember not liking the way I was feeling, but it was isolating at times because I didn't know. I thought it was normal, but didn't know how to communicate, how I was feeling to anybody. I was living away from my parents. I moved from early age when I was 16 and a half. I moved away from my parents. I went to another city, so it was a struggle. Yeah.
And did those struggles will continued into adult life? Huh?
Exactly, yes. And then, like I said, right before divorce started, that's when I went to seek medical help for my depression, and it took many years for me to actually seek help. I thought I would just grow out of it. I thought that if I just concentrated enough, again, I won't be depressed anymore, but it doesn't work out.
You're struggling with depression, you're struggling with anxiety, and then you have this sudden life change where your marriage is breaking apart, like you presumably separated from your daughter, and then you start to use opioids. What impact did the opioid use have on your feelings of depression and anxiety?
Well, you become numb. It numbs all your feelings. So you didn't have to deal with that.
It's like an escape.
It's an escape, exactly.
Okay. And then how long do you have that escape for?
You have it only for a few hours, and even less with fentanyl class, even less.
Fentanyl shorter than
Shorter, much shorter, yeah. So it's a matter of a couple hours, and then you have to use it again.
Okay.
Yeah.
So can you describe, I guess, your path to recovery? Well, when we first met, you were admitted to hospital at Vancouver General Hospital. Can you describe the circumstances around the reason you came into hospital and what was going on with you?
Sure.
Just immediately prior to coming?
Sure. I had an infection in my leg, and I was in a convenience store, I think, and I just collapsed. So they called an ambulance, and it took me to a hospital downtown, and so I was admitted there. And about 4 in the morning or so, I woke up. I went to the bathroom. I came back out, and the nurse came and asked if I used the washroom. I said yes, and she said that I have to leave the hospital because there's too much risk of people dying of overdoses. Didn't make any sense to me. I don't know why, but I think she just didn't like people like me, I guess. So she asked me to leave the hospital, asked me to sign a paper. I refused to sign it. I just left. And I waited until the morning. I went to my parents' house. And my dad told me to go to VGH, which I did. And that's where we met. You came to see me shortly after I was admitted, and asked me if I wanted to quit the drugs. And yeah, that was it.
No, I distinctly remember meeting you, and it was interesting because it was just the complexity of your case was profound. Right, you have somebody who you had a terrible cellulitis, you were septic, so the infection had gone into your blood. You had the cellulitis was quite advanced, so you had a lot of pain from the cellulitis. So there was severe pain, it was bad infection. You were also in a tremendous amount of opioid withdrawal from fentanyl use. So there was a withdrawal at play as well. And then there was a mental illness component because you were experiencing auditory hallucinations. You were essentially psychotic at the time. Right? So multiple factors were were influencing your experience in hospital. Again, infection, pain, withdrawal, cravings, and psychosis.
Correct.
So we had to address all of the factors all at the same time with an integrative approach. So, and the very first step was to manage the pain and withdrawal. So we started high dose. You probably don't remember a lot of the details, but we used multiple different medications for pain. We used opioids, hydromorphone for pain and withdrawal management, and we used what we call coanalgesics, so a multitude of other medications that are not opioids but are also for pain.
Okay.
For pain management. You're quite psychotic, so we use medications to help quell the psychosis a little bit. And once we got you a little bit more comfortable, we started talking about, okay, what are some potential treatment options for the opioid addiction? And then we gave you the different options, and we landed on methadone. So then we started the methadone. Or was it Suboxone? Suboxone, you're right. Yeah, absolutely. It was buprenorphine. Yeah. So we started Suboxone. And that's interesting as well, because again, the complexity of starting somebody on high dose opioids with a lot of pain on buprenorphine, had to use a particular protocol that allowed us to bridge you from the opioids to buprenorphine without experiencing any withdrawal.
Correct.
Something we call low dose inductions. So we did that. We got you on the buprenorphine dose. We finished the IV antibiotics. And a crucial component of your treatment, if you remember, was what? It was
my dad.
Your father, absolutely. Yeah. So he was at your bedside, and I remember he would wait hours for me to show up sometimes, just to talk about your treatment, how you were doing, potential follow-up or treatment after hospital.
Mm-hmm.
Almost every day I would, myself or somebody from my team would discuss, give him updates and discuss potential treatment options. I guess your path to recovery, your infection has been treated. You've completed the IV antibiotics. You're no longer necessarily experiencing withdrawal. You probably some element of cravings still experience, but you were still experiencing the psychosis.
Correct.
Right. So then we transferred you to the psychiatric unit.
Yes.
Again, like the treatment doesn't end when the medical treatment ends, right? Because there were still many active factors that were driving your previous circumstance of addiction and homelessness, including, of course, addiction, but also the mental illness. So we transferred you to psychiatry. And then do you remember what happened in psychiatry?
I was there for a few days, and then I left after 3 or 4 days, I believe. But when I left, I thought that I was going back to my regular life, quote unquote regular. I went back in the streets, and I lasted there for 2 days, and then I went to see my parents, borrow some money or something like that. And to my surprise, my dad told me that Dr. Singh, from psychiatrist from the hospital, sends an RX prescription to my dad, to the pharmacy, and called my dad and told him that the prescription is waiting for me at the pharmacy for whatever I wanted. And there was also an invitation from you to take me as an outpatient. When I heard all that, that's when I decided to really give it a shot, because I saw that a lot of people are actually taking this seriously, and they're willing to help me. So that's what did it. From that day on, I started changing my life.
Yeah, I remember that. I think that underscores an important point, and something that I try to instill in our residents and medical students, is that our responsibility doesn't end when a patient leaves hospital. Right? We've made a lot of gains while you were in hospital and in the psychiatric unit.
But I've been to hospital many times. I've had other infections and things like that. But this has never happened before. The doctor would come. Sometimes, most of the time, they wouldn't even ask you if you want to deal with your substance use. And if they do, they just ask you, do you want to deal with your substance use? I usually answer no, just like I answered you the first time, no, and they leave. But this time it was different. Like, even when I was still at the hospital, you were persistent, but you were very respectful, and you kept checking on me and sending your students and people from your team to talk to me, and they gave me a realistic view of how the treatment is going to go, and it's going to take many years, and it's going to be challenging, but it's doable, and people do it, and things like that,
Mm-hmm.
for a few days. So, and then there's the episode where I see that even after I left the hospital, the doctors are still thinking about my case and still trying to come up with solutions.
Yeah.
That made a huge difference.
Yeah. Oh, thank you. So I agree. It's important, and if it wasn't for Dr. Vineet saying, sending those prescriptions to the pharmacy and calling your dad, even though you had left his unit at the Seafield building, and offering you follow-up appointments with myself. You may not have. I wonder if.
No.
Yeah. So you ended up coming to your appointment. You saw me in my office, and we started working together.
Mm-hmm.
And that was also interesting for me as well, because it became clear that depression was a major factor. You're struggling with your mood, but also psychosis. So we had to treat both.
Mm-hmm.
And it was interesting to see how over time the psychosis became softer and softer and softer, and we were able to taper the antipsychotic medications until you were off of the antipsychotic
Mm-hmm.
medications and the psychosis was gone. Can you remind me how long were you homeless for, living under these circumstances? For 6 years.
6 years, yes.
What message do you have for the public, people who may be walking by and observing people living under your previous circumstances?
Sure. Well, just to remember that people have stories behind them. The people that they see in the streets sometimes, homeless people that they're not necessarily bad people, or it's not necessarily their choice. Sometimes there's people that suffering from mental health issues that are really, really deep, like trauma, things like that from their youth. So not to judge, not to be too harsh. I found people they're quite harsh with homeless people. Like, they're not understanding. Sometimes all it takes is a smile, to make a difference.
And how long has it been since you've been homeless now?
It's been over 4 years.
4 years. Yeah.
Almost 5 years.
And you're living with your family?
I'm living with my family still. Yeah.
And can you give us an update of what you're doing now?
Right now I'm finishing my bachelor's degree. I'm in my last semester, actually, in maritime studies.
You reconnected with your family?
I'm reconnected with my daughter. Yeah, I see her now regularly, which is great.
What does the future hold for you?
Well, maybe go and do master's degree after this, and work eventually. Find my own place. Yeah, it's positive.
Good for you.
Thank you.
Thanks so much.
You're welcome.
Thank you.